Hi, this is Kirk, the Bariatric Carnivore. Well, if I look a little bit sweaty today, it's because I've been incorporating something new into my workouts. I'll tell you more about that at the end of the video, but for right now, let's talk about medical scams. And this latest one, which is really kind of ticking me off. I have been trying to explain that the best way, that really, frankly, the medical system is completely psychopathic. They work with a complete callous disregard for your health, but also your financial health. They are not in it, the major medical chains, the major medical institutions don't give a rip about your health. They worry about their bottom line. And that became really apparent with this latest scam. And I will explain that as we go along. Now, a couple of major scams that have come up of late that are really fascinating was one, United Healthcare being caught with their hand in the proverbial cookie jar of just denying claims arbitrarily. Basically, they have an AI system that was going through their claims, and they would figure out, okay, for our bottom line, how many claims do we have to deny in order to remain profitable? And they know that 90% of people whose claims are denied will never appeal. So it is a numbers game. They are running a scam on people, and people are going bankrupt. The number one cause of bankruptcy in the United States is to have really good insurance and then to have a major emergency and have your insurance company just deny the claim. And when that happens, people go to bankruptcy court instead of suing the insurance companies for some damn reason. And as a result, we have more people going bankrupt because of these medical emergencies, because of the arbitrary things that insurance companies do. And it is a scam, and it is reprehensible that they are doing this to people, but they are. They are now the subject of a major class action lawsuit. We will see how that develops, but they have been losing like crazy on this one in a major way. Number two is one that it took an act of Congress to switch. What happens to a lot of people is they have insurance coverage and they have an elective surgery. They choose an in-network doctor. They do everything right. But they find out after they've had this surgery, they get this big bill from an anesthesiologist they've never heard of, who claims that they are not in the network, and because they weren't in the network, the insurance company denies the claim, and you're now on the hook for thousands and thousands of dollars of medical procedures that, frankly, there's no way you could have known they were out of network. They did not tell you that they were out of network. They just did it because the insurance companies and the hospital chains can do that. What they were doing is basically working in concert and saying, okay, we're going to we want you to start using out-of-network anesthesiologists so we can deny claims. And it was a horrible scam. It was so bad that Congress finally stepped in, and the law went into effect in 2022 in order to stop that. This is what you're up against in this psychopathic system. You have no idea how much anything is going to cost when it comes to medical care. When you go to a restaurant, you get a menu. You can decide whether you're going to have a hamburger or filet mignon. You can make a decision based on price. Basically the same thing, just different costs. Not so when it comes to healthcare. Now, there are some menu items that we know about. You know that when you go to a type 1 trauma center, the highest level of trauma care that you've got, that's going to be significantly more expensive than the emergency room, which is going to be much more expensive than just going to your doctor's office. So what do? We try to go to our doctor's office, which is the lowest cost thing. But they're not always open when you need them. If you need to get stitches at 7 o'clock in the morning, you can't get into the doctor's office. What do you have as an option? Well, you can go to the emergency room, which is going to be more expensive, or better yet, we've now got urgent care centers. And the urgent care centers are a great niche right between going to your regular doctor and going to the emergency room. Significantly lower cost, and that was a great option for a long time. The problem is more and more hospital chains started buying up the urgent care centers. Now, who runs hospital chains? Is it doctors? No, it's MBAs and people that are trying to make a buck and they're trying to improve their bottom line. Now, an urgent care center is not an emergency room. They do not have the same equipment. They don't have to stay staffed all the time. They run at a much lower cost and they pass that savings on to the consumer. But when a hospital buys out an urgent care, they claim that this is an extension of our emergency rooms. You wander in, you think it's an urgent care center. You expect to pay urgent care prices. So for instance, you go in, you get an x-ray, that should be $100. Well, you go to an emergency room, it's going to be $1,000 because they are covering part of the cost of that whole big facility on your x-ray. Urgent care should be significantly lower prices, but not so when the hospital chain owns it. They're going to look at it like it's an emergency room visit, and you're stuck with higher copays, or insurance may just flat out deny it to begin with, or if you're paying for it out of pocket like I do, you're stuck with significantly higher costs. Now, in this New York Times story, the patient in question was a physician who knew what the costs were for the particular procedures. Her daughter had an ankle injury. She wanted it x-rayed. Should have been $100. They charged her over $1,000. She had to fight them for over 6 months before they finally relented and went with the urgent care prices. What does this mean for you? Well, number one, heed my warning. Look, the American medical system is fantastic at acute care. They excel at it. But the medical system itself are psychopaths. I mean, they don't care about you. They are run by MBAs who are looking after their bottom line. Most of the people that own physician groups right now are not the doctors. The biggest owner of physician groups in this country is United Healthcare. Next, CVS Pharmacy. After that, private equity firms. They are trying like crazy to purchase these things, and when they take over a physician's office, the doctor no longer works for you. They work for a boss. That's why they don't look at you. They look at their computer screen and they keep filling out stuff all the time. And that's why the standard of quality of care keeps dropping. They're not doctoring anymore. They're just almost assembly line workers doing whatever the AI generated standard of care tells them to do. It's pathetic, it's horrible, but that's the reality. So what do you do about it? Get out. This is why I keep telling you, your only way that you can protect yourself is to get out of this horrible system by getting healthy. And the more healthy you can get, the better off you are as far as getting out of this thing and not having to play the game. And when you're out of that system and you no longer have a primary care physician, you can start working on your own health. You can get your own blood work. You can get catastrophic coverage to cover major events like auto wrecks or getting shot, falling off a roof, or like, God forbid, what happened to me, having a blood clot. That's an emergency. But what happened? Well, my coverage only kicks in after $5,000. It was a $25,000 visit to the emergency room and staying in there for a day and a half. It was an emergency. It was legitimate. Okay, I'm covered. If I'd had to pay for that all out of pocket, that would have sucked, but it would have been doable. But the cost of, that insurance that I've been paying for covers everything after $5,000. Much better system. That's what health insurance should cover. Major emergencies, not trying to get you a cheaper doctor visit. You pay a lot of money for just a slight savings as far as hospital visits, and frankly, when you need it, odds are they're going to just deny you coverage arbitrarily, and then you have to go to court to figure out how to get it paid for. It is a horribly psychopathic system that ain't working for your health, and it's not working for your financial benefit. It's working for the bottom line of major corporations. Just the reality. So, how do you get yourself healthier? Well, keep thinking about fun ways of making your workouts more challenging. And this is what I was telling you about why I'm still kind of sweaty from today's workout. I told you a couple times a week I do sprint training where I get up on a Schwinn Airdyne bike and I push as hard as I can for 10 seconds with 1 minute and 20 off between sets. And that in and of itself is a challenge, but I decided at 61 I'm going to kick it up a notch by adding in sandbag training. I've been kind of intrigued by this. So what I found on Amazon were heavy-duty bags which you can fill up with sand, and the bags are relatively inexpensive. You can get some good quality ones for 30 some odd bucks, and for $7 you can get 50 pounds worth of sand. So I've got these bags that are running about well over 50 pounds, but I can do HIIT training with them, and I get to do different lifts, and I'll do them for a minute steady, 20 seconds off, minute, and I'll keep doing that, and then I'll go off and do some carries up and down the yard. And I do that type of stuff, and it's a 5-10 minute workout that with a device that costs me under 50 bucks, that is really challenging. And the cool thing about sandbag training is it's a shifting load, which means you're developing what they call functional strength. You're lifting things that are shifting around, which causes your core muscles to work harder, and hopefully it is building up new muscles and strength that is going to help protect me from life's little emergencies so I can better withstand shocks and stuff like that. So, I remember the only time I had a compressed disc and I had some serious back problems when I was really overweight was when I was putting my kid in the back seat. Kid shifted around, it threw my back, caused all that pain. I don't want that ever again. So one of the ways I can help prevent that is by building up those type of muscles through doing sandbag training, which is kind of using that shifting weight. Putting your body under load, but doing it in a relatively safe manner. Relatively inexpensive. Nice way of staying out of the hospital. 50 bucks, and relatively cheap, hard workout that hopefully will build up that type of functional strength that I'll be able to use for the long haul. This is what you really need to do if you want to stay the heck out of the healthcare system. So, if you've used sandbags, do me a favor. Try to encourage me. If you could leave a note down below that, yeah, it works and it does build up strength, that would be helpful. I'd greatly appreciate that. If you've noticed that the healthcare system from the medical side and the billing side is just completely psychopathic, please share your stories below so that other people can realize that it is a bad system that you need to get out of. And if you, frankly, like this message and you think other people should hear it, would you please hit the like and subscribe? Leave comments below, share with others. That's the way you get around the algorithm of YouTube land and more people can hear this message. This is Kirk, the Bariatric Carnivore. I try to put out a couple messages each week. If you like this message, please hit the like and subscribe. I will talk to you again soon.